One of my key passions in knee replacement surgery has been to try and reduce pain around this procedure. You might have heard stories of knee replacements being very painful. And 15 years ago, I, along with Barry Phillips, my consultant anaesthetist, embarked on a journey of trying to improve the pain around what was traditionally a painful procedure. I was helped by improving implant design, where the evolution of knee implants has allowed for better pain control. Surgical technique is improved, and as I've gone through this learning curve and team building, having learned on these 8,000 knee replacements plus, we've made the surgery shorter. In most cases, a knee replacement takes approximately 30 minutes in a Formula One type setting. And I'm working with people I've worked with for 10 to 15 years, and we're doing it all the time. So that reduces the length of surgery, but therefore the complexity. We are able to do it through a smaller incision, and that reduces the trauma around this elective procedure. We have developed techniques to reduce the bleeding and to limit that by infusions of things that reduce the bleeding post-surgery. And that reduces swelling and then improves function, not only in the short term, but in the long term. And the evolution of anaesthetic techniques using what we call multimodal analgesia, meaning you use different techniques in conjunction to reduce the pain, has been highly effective.
So this combination of anaesthetic really stands out at being able to get you recovering very rapidly. We call this rapid recovery. And we have this very specific sequence of care, not only during the anaesthetic, but in the after period, to allow you to do normal things quickly. The most important thing often for patients is their anxiety around being aware during the surgery. And so commonly I'll often have them asleep, and we find that a helpful combination. Also, additionally, we'll put local anaesthetic in the lower back to numb you from the waist downwards. That's really, really good because it means that you're nicely comfortable when you wake up at the end of that procedure. And we'll also additionally put some local anaesthetic in around the knee so that, again, it adds to that comfort level when you're in recovery post-surgery. Our focus is also about getting you up, having rapid recovery, so getting better and doing normal things quickly. To enhance that, we've developed this technique of drip feeding local anaesthetic to the knee over the next couple of days, and we find that hugely beneficial and really gets rid of the pain post-surgery. This is hugely helpful, not only because it's great for you, but the reality is you'll be able to get on and do all the things that we need you to do post-surgery to do really well.
When you go home, we have a bespoke protocol of pain relief, whereby we titrate various different classes of drugs and the timings of them to reduce your pain. And as you get better, you de-escalate off some of the more stronger medication to then need very little within a couple of weeks of surgery.